We want you to get all the information you came for this afternoon. So you know, we actually are skipping the lecture sessions. We've been doing this for the past 4 town halls, and this is the last town hall. And the thing about COVID is that COVID, unlike a class where you get the lesson and then the test, in COVID, you get the test and then the lesson. And that's how it is in our town halls. We take the test questions and then afterwards in the answers, give the lessons. Before I start, I need to do the land acknowledgement. This is such a small baby step towards creating a new culture of respect for our Indigenous people of Canada. We are on the grounds of Takaranto, the traditional territory of Mississaugas, Iroquois, Anishinaabe, and Chippewa. Treaty 13 and Williams Treaty both include Toronto. And as Justice Marie St. Clair said, and I quote, "We owe it to each other to build a Canada based on our shared future, a future of healing and trust." Thank you again. I also always in these events acknowledge ancestors, and what I've been doing in the past few is talking about people who have contributed to vaccine developments, like Onesimus, the enslaved African who introduced the concept of inoculation to the Bostonian, the American owner, Cotton Mather, and saved countless lives in Boston. And today I want, because it's the end of Black Mental Health Week in Toronto, I thought of Booker T. Washington, who introduced to the US National Negro Health Week, and it lasted for about 50 years in America. But when he introduced National Negro Health Week in 1914, Booker T. Washington said something back then that could easily be said in 2021 and be very relevant. He said, and I quote, "Without health, and until we reduce the high death rate, it will be impossible for Black people to have permanent success in anything, whether business, property getting, acquiring an education, science, technology, or to show other evidence of progress." Isn't it strange? That's more than 106 years ago and still so relevant in 2021. You know as well as I that Black health professionals face tremendous risk. We'll be talking about those risks. Racialized pay risk. A Black person with a university education in Ontario makes 80 cents for every dollar that their white peer makes, and so on up the ladder as well as down the income ladder. They also face intersectional risk. According to a study by the Clinical Evaluative Science Canada, Astrid Gutman et al., being a healthcare worker accounted for a very high percentage of positivity among women who had immigrated from Nigeria, Jamaica, and the Philippines as economic caregivers. That's an intersectional risk because race and gender go hand in hand. And if you can't really disentangle one from the other. Adding insult to injury is the fact that many of these health providers face racism that's not been given priority in their workspaces. On top of that has been the issue of PPE, protective equipment that should have been a no-brainer that wasn't provided or guaranteed. So these are some of the things we'll be talking about today. But we also didn't just want to talk about risk. We wanted to talk about the tremendous resiliencies that we know Black health professionals have, that they have long drawn on before COVID added or amplified the challenges they were facing. We have long had to live with compassion fatigue, vicarious trauma, which has been amplified during COVID because we're providing care to others and we are losing people to COVID at higher rates than others. So grieving while trying to provide excellent care. It's been a huge challenge. We've been doing mindfulness, breathing, all that self-care work, and we actually need to do more of it. We've also been facing several sources of anxiety stereotype threat. Some of us have complained of the imposter syndrome because of the racial microaggressors they face, where people question their capability and credentials because they're Black. We have all been managing stress. And one of the keys that I myself have used has been humor. The humor in dealing with situations which are so ridiculous or preposterous, that's a big word, preposterous, that you just have to laugh and don't take it on. So I'm so glad today that we have this panel, well-rounded, deep expertise to share with our communities. And I say communities today. And I'll turn you over to Paul Bailey, the Executive Director of the Black Health Alliance, whom I have to thank, not just Paul, but the Alliance for supporting us this afternoon. I also want to say thanks to Taibu Community Health Center for their unlimited support for our efforts, as well as the City of Toronto, which has shown incredible leadership in supporting us to address some burning issues during this COVID pandemic. Over to you, Paul.
Good afternoon, everybody, and welcome again. We'll jump right in and jump into introducing our speakers. And I'll start with Nicole Welsh. Nicole graduated from McGill University in 2000 with a Master's of Science degree in nursing. She obtained her RN license in Ontario in the summer of 2000 and worked at Brampton Memorial Hospital and Mount Sinai Hospital in Toronto. In 2001, Nicole joined Toronto Public Health and is currently the Chief Nursing Office and COVID-19 Liaison Director. Nicole's passion for ongoing learning has also led her to the final stages of pursuing her PhD in Applied Psychology and Human Development at the University of Toronto's OISE, Ontario Institute Studies in Education. She's passionate about issues related to health equity, social justice, and supporting the development and maintenance of healthy communities. Welcome, Nicole. Our next panelist is Dr. Upton Allen. Dr. Upton Allen is professor at the University of Toronto and the division head of infectious diseases and the senior associate scientist at the Child Health Evaluative Sciences program at the Toronto Hospital for Sick Children, also known as Sick Kids. Welcome, Dr. Allen. Dr. Adisa Azubuike is our next panelist. Dr. Adisa is a clinical psychologist who graduated from the City University of New York and has practiced for over 30 years in Albany, New York and Toronto. He has extensive experience working across the development spectrum with children, adolescents, youth, young adults, couples, families, and groups. He has consulted to and worked in community agencies, providing program development, psychotherapy, and also supervision. Welcome, Dr. A. Our next panelist is Dr. Candice Todd. Dr. Candice Todd is a naturopathic doctor with expertise in health promotion and disease prevention. Dr. Todd completed her honors Bachelor of Science Health degree at the University of Western Ontario, and from there she's followed her passion for health by completing an intensive four-year program at the Canadian College of Naturopathic Medicine to earn her Doctor of Naturopathic Medicine diploma. Welcome, Dr. Todd. We're going to jump right into the questions that have been prepared. And the first question is for Dr. Todd. We're having a lot of conversation about the difference between COVID-19, pneumonia, and influenza, and whether or not doctors are able to distinguish between those three. There's also a lot of conversation about deaths from other causes being counted as deaths for COVID. The question that I have here for you in the context of that is it true that a good diet, exercise, and vitamins A and D can best equip a person to cope with COVID-19? Over to you, Dr. Todd.
So thank you guys for having me, first of all. So sort of jumping right into it, definitely there can be overlap when it comes to symptoms of COVID and pneumonia and the flu. And yes, it can be hard to distinguish symptomatically, but that's why we test. And then just sort of going into the question about diet and exercise and vitamins A and C, absolutely these things can help to support immune function, help to support our immune system so that we can be, sort of resilient in that way. But do they confer protection against COVID? They don't. And I think sort of the bigger question or the bigger picture that I want people to see is that we're trying to stop you from getting to that point where you have to cope with COVID or cope with the disease process. Anybody who gets COVID tells me that you don't want to get COVID. There is the severity of disease and then the potential for death. It's just it's alarming. It is very uncomfortable and can have lasting effects. So in terms of conferring protection against the disease, that's not the case, but absolutely these things can help you to support your immune system and be resilient in that way.
Thank you for that answer. I think the next one's for Dr. Allen. Dr. Allen, I'm personally concerned whether or not, the vaccines that have been developed have been tested with enough Black people, and whether the vaccine that people have, the folks that are distributing vaccine, whether or not those folks have been vaccinated themselves. Can you help to illuminate us a bit here and address that point?
Thank you very much, Paul. That's a great question. In the Pfizer and the Moderna vaccine trials, the first two that came out, there were approximately 10% of Blacks, 10% of the study populations were Black people. And this is 10% of about 37,000. So yes, Black people were included in those trials. But it's really important as well to note, though, that there are additional trials that are being done now, including trials that involve children. And so it's going to be really important that those trials include Black participants, and that Black participants should feel encouraged to join those trials. Your second, at least the second part of your question relates to the people given the vaccines. And first of all, it's really important that they serve as role models themselves and get vaccinated, whether or not they are Black folks or white folks or whatever race they might be. But I just want to say something that's real important, and that is, I've been really impressed with how people have stepped up to the plate to administer vaccines, regardless of their race. And so whether or not the vaccine is being given to you by a Black person or a non-Black person, these are caring individuals who have made a conscious effort to become engaged in the vaccination process. And so there are going to be times when the person giving you the vaccine will look like you, but there are other times that the person might not look like you. The bottom line is that you can trust these individuals, they're caring individuals who have stepped up to the plate to ensure that we all get vaccinated in a safe and effective manner.
Thank you for that very concise and illuminating answer. Next question is for Nicole. Will folks have the opportunity to decide what vaccine they're given? And can they select a vaccine that has less or fewer side effects on Black folks?
So thank you for that question, Paul. And so currently, the opportunity to select a vaccine is not available. It's really an issue of supply and demand and the ones that are currently on the market. So you may have heard recently that Johnson & Johnson did receive approval here in Canada. So there are 4 vaccines that are currently available. And as Dr. Allen just discussed, the testing has, or the trials had Black individuals in the trials as well. And there has been to date nothing found that is different in their experiences of the vaccines. And one other thing that we get asked often is how are any side effects or adverse effects being tracked here in Canada when we are administering the vaccine. And there is a very comprehensive program where any effects that are experienced by individuals are tracked and kept, solid records around that. And currently these vaccines have proven to be safe and have good efficacy in the population. So at this time, no, as more vaccine supply becomes available, things could change. So you always have to keep your ears and your eyes out for information as we get new updates happening. It feels almost daily. Thank you.
Great, thank you for that. Next question is for Dr. A. We've had a lot of conversation about vaccine hesitancy, vaccine resistance, and how we build vaccine confidence. What about the idea that we Black healthcare workers have been traumatized by history of systemic anti-Black racism by the health system? Is this relevant to understanding vaccine hesitancies?
Thank you for that question, Paul. Hello, everyone. Of course, it is relevant to understand the history of anti-Black racism and the systemic racism that almost all of us have encountered at some time in our professional lives. But it's also important to recognize that because of that, there is going to be some hesitancy, and to understand that in the context of where trust has been eroded, it takes some time for trust to be built back. And the recognition that even though this has been our history, the other part of that is that our future depends on us surviving. And our ancestors survived through many deleterious conditions. And for many of them, they had to make certain choices that led most of us to be sitting here and talking today. So I recognize the hesitancy, and it's understandable what we have gone through, but we also have to realize our future and our present depends on us taking this vaccine and questioning, asking questions, having questions be answered, but recognizing that this is also part of our survival, one of our survival skills to acquire.
Thank you for that. For Dr. Todd, what advice would you give to people who do not have a known diagnosis around COVID, but who may still be at increased risk of catching the virus because of where they live and other risk factors? Oftentimes, we know that folks in the community may not have a regular primary care physician or go for regular medical treatment, and may be unaware of, other conditions, things like hypertension or diabetes. Are there ways to address the amplified COVID risks without getting prescription drugs and taking vaccines?
So I guess that's sort of a two-part question. To answer the first part, you really have to assess your risk for disease. And COVID is a disease that needs people. And when you live in sort of dense population, so if you're living in an apartment building or you live in a house with your parents and your kids, these things are things that are increasing your risk to catching COVID. So vaccination is something that you might want to consider when you, based on your risk factors. Doing all of the things that I mentioned with respect to supporting immune health are not going to, again, protect you from getting the disease. And when you are increasing your risk in that way, it's important to consider other options as part of sort of your toolkit around how you're protecting yourself. The other part of the question, we know that underlying conditions, comorbidities are things that increase your severity of disease and increase the death rate when it comes to people who catch COVID-19. So I would say that one of the things that you can do to protect yourself in this situation. And this sort of lends to a bigger conversation that needs to be had around systemic racism, around mistrust of the healthcare system. But one of the things that we need to do is get our regular checkups, know what your numbers are, know what that health status is for you. If you have uncontrolled hypertension, uncontrolled diabetes, there is little that can be done to manage it in a way that is sort of quickly when we're just looking at diet and exercise and supplementation. So there are limitations there, especially when it's uncontrolled. Definitely get your checkups. I know that we do have this mistrust a lot of the time, but it's important to do that as step one. And I would listen to your doctors. If you are prescribed a medication, it's likely for a reason. Again, we want to make sure that these things are not out of control, because they can impact your severity of disease. If you don't want to get the vaccination, if you don't want to do, take your medication, then, that is obviously your choice. But be prepared to stay inside, self-isolate, do all the things that are sort of protecting the community spread, especially if you are in that dense sort of living condition. So if you're not interested in vaccination or not willing to take your medication, definitely do all the things that can help to support health, nutrient-dense food, exercise, maintain social connections, protect your mental wellness. But in that situation, what's really protecting you is self-isolating, wearing masks, social distancing, and hand sanitizing. So preventing community spread.
Thank you for that. And I'm going to go off script for 2 seconds. Dr. Todd, you said a second ago that folks should think about what's in their toolkit, their health toolkit. They should know their numbers, etc. Wanted to give you an opportunity to maybe just provide some more detail there about the critical things that we should be thinking about as it relates to this toolkit. And Dr. Allen, feel free to jump in there if you have some thoughts as well.
Yeah, so definitely what should be included in your toolkit, because we know that we are overrepresented when it comes to those comorbidities, including hypertension, diabetes, obesity, cardiovascular disease. You want to do things that are going to protect yourself from chronic disease and help you manage chronic disease. So those are things like eating nutrient-dense foods, exercising daily, maintaining social connections, being mindful about protecting your mental wellness and your mental well-being. But again, those are sort of bigger conversations that need to be had because they are related to access and food security and social determinants of health. So sorry, did I answer your question?
I thought it was important that we reinforce that we're dealing with a particular disease here, but there are other pieces that folks.
Yeah, so definitely part of that toolkit. Sorry, that was a question. Can include vaccination. It can include supplementation. It can include nutrient-dense diets, exercise, and all of those lifestyle things that help us to be healthy.
Thank you for that. Next question is for Dr. Allen. We'd like to know how the immunization process is affected if somebody gets infected shortly after getting the vaccine. Will the immunization result be adequate for avoiding the hospitalization and getting into the ICU or potentially death?
Thank you, Paul. That's a great question. There's several parts to that. The first thing to bring out is that after receiving the vaccine, one still has to, and one should, take all the usual precautions that public health has told us that we need to take. So that's really important. We still have to wear a mask, physical, social distancing, hand hygiene, stay well, all of those things we should still do. It is possible that we might get COVID even after being vaccinated. The important point, though, is to remember what vaccines do, what sort of outcomes we're trying to prevent. And I just want to highlight 3 outcomes that we try to focus on when vaccines are given. Number 1 is that we want to prevent mortality. We want to prevent people from dying. And so far, these vaccines are essentially 100% in doing that. That's amazing. That's a real good news story. The second thing is that we want to prevent people from having severe illnesses due to COVID that result in them being admitted to hospitals, including ICUs. And again, these vaccines are pretty close to 100%. That's also another amazing story. And the third outcome relates to preventing any infection, any COVID or milder COVID. And that's where one may get a range of effectiveness. And so the bottom line is that even if somebody gets COVID after being vaccinated, it is likely that what they're going to get is a mild illness. And that's a really important point to get across to folks, that that even if one gets COVID after being vaccinated, it's likely that what you're going to get is going to be a mild illness. So that's really an important take-home point that one should bear in mind. Now, there are several other considerations that one should bear in mind in relation to a dose of the vaccine and whether or not one, how one handles a situation where one gets COVID after a dose of the vaccine. The bottom line is that if you get vaccinated with 1 dose and then you got a COVID, which is likely to be a mild illness after that, you will still need your 2nd dose when it's due. And so, and even if you got COVID before you got vaccinated, once you've recovered, you should still get your shots as scheduled. Does that cover the key points that you wanted me to cover?
Yes, it does. Yes, it does.
Thank you.
Next question I have is for Nicole. And it centers around the right to take or not to take the vaccine. So what are the rights of workers when it comes to their jobs and not wanting to take the vaccine? Can somebody be fired from their nursing job, for example, for not taking the vaccine? And is there any public health advice or advice that you can give in this regard?
Thanks for that question, Paul. So the vaccine is not a mandatory vaccine. There are no vaccines that are mandatory to take. However, it's strongly encouraged to take this vaccine, and employers may strongly encourage their employees to take it. As far as situations, if someone can be fired around that is, unfortunately, I'm not a lawyer, so I can't give any legal advice around that, but just to reassure people that it is not a mandatory vaccine. So people do have the choice to make an informed decision on if they will be taking the vaccine or not. In situations, they should check with their particular employer. There may be policies in place that if there is an outbreak or continued pandemic happening, that individuals that do not take vaccine are excluded from the workplace for a period of time. But that would be dependent upon the particular employer and which policies they have in place. If an individual does have any concerns about how they're being treated in the workplace or what their employer is advising them of, then they should seek legal advice or employment law advice around that. From a public health perspective, of course, we strongly support individuals to take the vaccine, as Dr. Allen was mentioning earlier. The decreased mortality, decreased illness, etc. These are all very key things, particularly in our population. As Dr. Todd was mentioning, we do suffer from chronic diseases at a higher level that puts us at an increased risk. So, she mentioned diabetes, high blood pressure, et cetera. So it's very important that individuals do take this. In some workplaces, people will have an increased risk just from the nature of their work. People may be very familiar with the Canada Post situation where people are working indoors with lots of people in close quarters, and how quickly it can spread, especially with these new variants, which are about 40% more contagious. So it is something that you really want to take in consideration, what type of employment you're in. Some individuals are able to work from home, so their risk would be a little bit less, and have that conversation with your employer. So I hope that answers the question, Paul.
It does for me. Picking up on your point, around a lot of folks working from home. I know myself, I'm in the office some days, as I am today, but oftentimes I'm at home. I have the privilege of being at home with a few other folks in my family, but I have a lot of folks who I'm connected with that are actually on their own for an extended period of time for the first time in their life. Months and months and months and months spent on their own. Nobody really in their house to talk to. They can talk via Zoom, but that's been it. We know that certain things are key to what we think as Black life or living life as Black folks. Community activities, community meals. Whether it's a soca fit for the Trinis or church for other folks, places of worship or the mosque. This question is for Dr. A. How do I stay mentally well? How do I keep my mental health at the forefront of my thinking in the context of this kind of dislocation? What's some of the advice that you might have there?
Thank you for that question. That's a very, very good question. And I think, Paul, that's the heart of a multitude of questions that people are going to be sending us. It's a tough one because people often accuse us, psychotherapists and psychologists, as repeating very simple things. But it's, as my old aunt used to say, simplicity is elegance. And sometimes in the simple things is where we find help and health. One of the things that we may have to do is recognize that because we don't have access to the things that make us who we are, and again, us as even human beings, about connecting with people, reaching, I think this pandemic has showed how much socializing and connection is so important. Often there are some anthropologists who talk about it's not the survival of the fittest, but it was the survival of the friendliest that has caused us to evolve to where we are. And so social connection and connecting with people and doing things that are community-based is very, very important. So I hear and I understand the fact of how much isolation can have an effect on you, not being able to do all the things that you wanted to do. For the Trinis out there, Carnival and all the other things that went by, Caravan and all those things. So what do you do? One of the most important things to do is trying to stay in the present moments, trying to stay in the now, recognizing that right now, I can't predict about tomorrow, next week, whether the lockdown will be raised or not, but staying in the present and what can I do now in taking care of myself. Apart from all the things that we have said before about having restorative sleep, eating nutrient-dense diet, exercising and all that, and reaching out to our friends and family through online resources. I know it's not the best, but we still need to do that as often as we can. But coming back to staying in the now, meaning is, what am I doing now? What am I feeling now? What can I do now? Am I reading? Am I reading the Bible, the Quran? Am I studying something academically? Am I reaching out to my friend now? It's when we get in the future that we often are very, very overwhelmed. And when we ruminate about the past, often that we can get very, very depressed. When you stay in the moment, it really is best to help you psychologically. So staying in the now and taking steps to do the things that may not be 100% what you normally do, but it still gives you some relief, it gives you some stimulation, and it gives you some respite from what we all are going through.
Beautiful. Thank you for that. I think kind of building off of that, question for Dr. Todd. We know that this is an increased moment of stress for a lot of folks, stress related to COVID-19, but a lot of folks experience, what folks call racial stress, whether it's from the outside society or often for Black professionals, it can be something that happens in the place of work and particularly with their parent or with their patients. So what advice would you give to some of those Black health professionals who are getting lots of that racial stress from their environments? What are the options for folks that are, very stressed out in this moment?
Thanks, Paul. So I think Dr. A really touched on a lot of those amazing points about what we can do to help ourselves to be more resilient against stress, whether it's racial stress or not. I think one of the big things, especially for Black healthcare professionals and Black female healthcare professionals in particular, is that just recognizing that this is stress. In practice, for example, I've been getting so many patients who are frontline healthcare workers, they're nurses, they're PSWs, and they're feeling these symptoms, the way that stress manifests in our bodies, anxiety, palpitations, digestive concerns. So just recognizing those things is really important in addressing it. I think as women, Black women, there is this notion that we are strong Black women and that we need to sort of carry everyone on our backs. And when we are not taking care of ourselves, we can't do that for others. So simply recognizing that this is stress is really important, and taking the stigma out of seeking professional help, seeking a therapist, seeking somebody to sort of help you get through these processes with, and seeking that with somebody that looks like you, I think is really important in terms of helping us to cope during this time and helping us to remain resilient so that we can do all the things that we do for our families, for our patients, for our friends, and so on.
Thank you for that. Going to move into just some other questions around the actual vaccine. So I guess a question for you, Dr. Allen, or a few questions. What is the efficacy of the vaccines across the different variants? So the UK, the Brazil, and other variants.
Thank you, Paul. I know that's a very frequently asked question. Let's step back a little bit and recognize two different phases when these vaccine studies were being done. The first phase, I'm going to call that the smooth running phase, in terms of if you imagine a car in a speedway track, a smooth track, the first 6 months or so, 6 to 9 months. And that's a phase when the first two vaccines like Moderna and Pfizer were done. The second phase, the more recent 3 to 6 months, is that bumpy phase of, so to speak, and like a car on a bumpy track. And that's when the other vaccines were evaluated. And so essentially that bumpy phase represents a phase when the variants started to appear. And so because of that, you might see differences, and we have seen differences in the efficacy, but these studies were done at different times. First, when it was smooth running, and second, when it was a bumpy road. And so we shouldn't focus on the numbers per se, but recognize that the vaccines that have been approved are actually really quite superb. And so bottom line is that we recognize that there will be some differences in terms of overall effectiveness against the different variants as they emerge. And this is something that we have to monitor and watch very carefully. But one way to think about it is if you take a vaccine that is in excess of 85, in excess of 90% efficacious, and even if the efficacy drops quite significantly by 20%, you still have a very superb, an excellent vaccine. But definitely, we should monitor things moving forward as these various variants emerge. There are a couple other things I just want to mention, and that is when we think of how well vaccines work, we think not of just the results of the clinical trials, the efficacy trials, where one group got the vaccine and another group got a dummy product, and you see whether or not it prevents COVID. But you also think of how it works in real life, in practice, the effectiveness part of it. And there are several things that might influence how well the vaccine works in real life. So storage conditions, convenience, how you deliver it, all of those things are very important considerations in practice. So the bottom line is perhaps then not to focus so much on the numbers, but recognize that the vaccines that have been approved are all superb, and we should take whichever one comes to us first. And I like to give examples, Paul, as you know, and the example I give is not necessarily that I endorse these three cars, but high performance BMW, a high performance Mercedes, and a high performance Audi. I'm going to take any one of those. The first one that I can get my hand on, I'm good, because I don't know what's going to come after that. And I think that's essentially what we're dealing with in terms of the vaccines.
Maybe just one quick follow-up there too as well. I think to differentiate the difference between some of the vaccines, we know at least with the Pfizer and Moderna mRNA vaccines that, folks have to take 2 shots. So the question is, why is it necessary to be, inoculated twice or to take those 2 shots?
So that's a great question. So those vaccines were evaluated with 2 shots, an initial priming dose and then a booster dose. And whereas another vaccine like the Johnson & Johnson product, a single shot. And so that's what was evaluated. And generally, that tends to be what is recommended in practice. Now, we know though, Paul, that after 1 dose with any of these vaccines, one gets a significant level of protection against severe disease and mortality, which I alluded to earlier, and that's really extremely important. Now, there's another twist to all of this, and that is it's quite possible, Paul, that as variants emerge over the next several months, it is possible that the nature of second dose boosters could potentially change. And the various companies developing the vaccines, or as we speak, having a closer look at the formulations of their products to ensure that they take into account protection against emerging variants.
Makes perfect sense. I have one more question for you, Dr. Allen, before we move to Nicole. I think it's a good follow-up. So if the vaccines that we know that have been approved contain the same or similar ingredients, I personally haven't read the ingredients, but probably should. And we know that some are more effective than some. So why is it that, for example, the AstraZeneca vaccine may not be approved for seniors, but others may be. Is there a difference in what's in them? What's the rationale for deciding who gets what?
So that's a really great question, Paul. It's an important question. Generally speaking, as a rule of thumb, when vaccines are approved for particular populations, it mirrors almost 100% what was studied in the efficacy trials, what was studied in the clinical trials, because that's where the data are. And we don't like to use vaccines in situations where we don't have data. So that generally is what is followed. And so in the situation where in AstraZeneca, if there weren't individuals above a certain age, adequate numbers of those individuals evaluated in a clinical trial, then you don't want to make a recommendation to use a vaccine in that group until you have those numbers. And in fact, there are other examples like that. For example, in the Pfizer, Moderna vaccines, children below 16, 18 years of age were not included in those trials. And it's for that reason why we can't make recommendations, we can't make concrete recommendations for using vaccines in children. So generally, they mirror the populations that were studied.
Oops, sorry, I was on mute. I got you there, and thank you for that concise answer. I'll give you a break now and move to Nicole. How important will it be to vaccinate children, and when can we expect for that to be a thing and for children to be vaccinated?
So it would be very important to vaccinate children. I think, but first I'm going to start with what we're seeing currently in schools in Toronto. So I work very closely with the schools in Toronto, and that's under one of my responsibilities at Toronto Public Health. And what we've seen, particularly in December, when community case counts were quite high, that cases that were in the community, kids were contracting that usually from household contacts or members in their household and bring it into the school. Because of the measures within the school that we have, we saw a very limited transmission in the school setting. But the issue with children is, those measures are very hard. So it's the physical distancing. I will say children have been anecdotally, I don't have a scientific study that I've conducted, but pretty good at mask use. But it's the physical distancing and not being able to socialize and play with their friends outside of their cohorts, extremely difficult on children, and including teens who are in modified class schedules right now where they're in class for a very limited time. They don't have the sports, they don't have the social activities such as school dances, etc., which is a big change and something in our society. I spent the majority of my public health career encouraging physical activity, encouraging children to play and be more active. And we know that's a very important part of healthy child development. So getting a vaccine for children, and Dr. Allen did mention that in his, as he was answering the last questions, will be very important. So the study is happening. We know for 16 and up, it's available for children that I believe it's 12 to the 16 range if they are immunocompromised, and based on our conversations with their physicians, they may be eligible. But those studies are happening, and we look forward to having a vaccine available as soon as possible. I don't have any solid information or evidence when they would be available. Hopefully in the fall would be great, but it's to get the kids back to those normal activities so that they can be children and enjoy life and socialize. And, as a parent, we say, go outside and play with your friends. But right now it's, it's hard because we're saying, don't go too close, don't, all this stuff. So to get back to pre-COVID times for our kids will be so essential. So yes, important to vaccinate the kids. I will say, we know with children that death is very low in children, and as well as severe illness. So they don't get as sick as the rest of the population. However, they can still get COVID. So, until we get that population vaccinated as well, we would want to have public health measures in place.
Got you, and thank you for that comprehensive answer. Question first for Dr. A, but perhaps I'll pose it to the other folks before we go to break. So we know that systemic anti-Black racism, particularly in the context of healthcare and social services, is rampant, and many folks feel as if you know, healthcare workers or some folks in the healthcare sector don't care about Black folks. We heard a little bit about some of the disproportionalities that people are experiencing, but also, you know, organizations have been trying to address. So the question is, why would I take a vaccine from folks who care less, who couldn't care any less about Black folks? And if nobody's focused on the health effects amongst Blacks, etc., you know, how should we kind of approach this conversation? So again, the context of systemic racism, in the context of this conversation about vaccine, where folks are not sure if people care or not, you know, how should we be approaching this kind of duality and thinking about this? Does that question make sense?
Yes, and thank you, Paul, for reading that question, and I'm going to be quite short and then give it up to the rest of the panelists. I think two things. One is recognizing that all that was said about systemic racism and all that's going on and all that has gone on before, but recognize that we are having panels like this. We have healthcare professionals that look like us that are trying to reach out to the community, and we have allies who also want to help us. But I would say, even if you're still distrustful, then be part of the resistance. And the resistance is this, and I'm not being just facetious, is if you worry that people are trying to kill us or get rid of us, the resistance is not to die. The resistance is to survive. And part of evolution is for us to be here. So I would say, do the things that protect your community, do the things that protect your family. As Nicole just said, a lot of times we get some of the infections from family members and within our community. So if you take the vaccine, if you wear the mask, first you're protecting yourself and others who you care and love about. So think of yourself as, okay, I might still be skeptical, but I'm going to be part of the resistance.
You know, I'd turn it to, you know, other folks, even back to Dr. Kente. I know, you know, a lot of the folks on this call, if not all, are on the Black Scientist Task Force. And, you know, because I happen to be in this space doing some of this work, we also know that there's a lot of work that's happening silently in the background, trying to make sure that there's an equitable response, that Black communities are served. So don't want to put anybody on the spot, but, you know, perhaps Nicole, if you could talk a little bit about what's happening in Toronto Public Health and how it's interfacing and hearing from community around, you know, the equitable response and some of the things that have come out of that. Other folks who have perspectives from the Scientist Task Force or Dr. Kente, please jump in.
Thank you, Paul. Since you called me out, I can start with some of the work that we've done. And Toronto Public Health has been involved with this work, but it's a larger City of Toronto response and working with other divisions within the City of Toronto as well. And looking at a COVID health equity plan and working with Black health leaders in Toronto and outside, quite frankly, to really look at the issues that are pertinent to our communities and ensuring that we can address the issues for the immediate short-term response so that we can have individuals have access to vaccine, have access to testing in the community, have access for other, you know, like PPE, et cetera, that would be help to keep them safe. So the city has embarked on that work, and some of the community health centers as well have community ambassadors that have been doing a lot of work right, you know, on the ground, meeting with residents, having the conversations. The city also will be hiring neighborhood ambassadors and working with community agencies. And so all this work is really important to get the information out so that people understand more about COVID in the earlier days. So I'd say over the summer, we were doing a lot of work directly in the community, and it was just talking to people and myth busting sometimes. So we talked you know, about the mistrust with the larger healthcare system. So it was really important to have those conversations and reach out to leaders in the community because they will be the ones that can share this information and are trusted by the residents of the community. So it's all very important work, and we really trust and depend on our community agencies and community workers that are embedded in the community to get the work done and get the information out there. I hope that answered the question a bit, because there's a lot of work going on. So, and you can talk to it too, Paul, because you've been quite involved in a lot of this work, which we greatly appreciate as well.
It does. Did anybody else have anything to add there before we jump over to break?
I can comment, Paul, perhaps just two comments. Number one is, and I agree 100% with what Nicole has mentioned, including trying to dispel myths and misconceptions. At the end of the day, it's going to be extremely important for all of us to ensure that if people choose not to be vaccinated, which is their right, they make that decision based on correct information. Because we would feel so bad. I would probably not sleep if I found that somebody made a decision not to be vaccinated based on wrong information. That'll be a bad situation. So we're really, all of us are in this together, wanting to ensure that people get the right information so they can make an informed decision. That's the first one. The second point is alluded to, and I believe Dr. Azubuike had addressed this, and that is the confidence in people providing information and vaccinating us. That's so important. The trust factor is important. It's really important that we engage, and Nicole has alluded to this as well, engage people from the community who people trust and have trusted for many years, to help them with the provision of information, but also vaccination. I should also mention that in the process of making a decision and trusting the vaccines, it's important to recognize that there are people behind the scenes who look like us, who have led the development of these vaccines. And I know that 100%. I am personal friends with a couple of them who have led the development of the vaccines. And these are people that we can trust. So in other words, there are people on the inside who have our backs. And so that, I think, is really important in recognizing and trusting the vaccines that are being delivered to us.
Thank you for that. And on that note, we'll break for about 5 minutes and then come back for some more discussion and questions. Thank you. All right, everybody. Welcome back again to the Black Health Professional Risk and Resilience in COVID-19 panel. Great. Gonna jump right back into some of the questions here. And probably going to do it a bit differently in this section. We're going to start to go to the questions that are coming back from attendees and then folks participating. So folks can feel free to enter their questions in the chat. We'll ask a panelist to answer a particular question, but again, feel free for other panelists to jump in here and to answer those questions if you think it's in your wheelhouse. So the first question is really for Dr. Todd here. Question from Lisa Jones. I've heard claims that doctors are told to mark COVID as the reason for certain patients' conditions when they are discharged, whether or not they've had COVID or not. While I'm skeptical about the truth of this statement, please respond to whether or not there's any truth to this and whether or not you believe, where you believe these claims are stemming from.
So great question, Lisa. This is not something that I've heard personally, and maybe some of the other panelists can jump in if they have heard this. And I guess it's sort of leaning or lending into some of the myths that are going on around there regarding inflating numbers or, calling COVID deaths, calling all deaths COVID when, there's potentially the potential that it hasn't been COVID. So I think it's sort of leaning in more to myths that are circulating out there. And I don't believe that is the truth.
Got you. Anything to add there from the panel? Okay.
I agree 100% with Dr. Todd, Paul. I can't think of any reason why that would happen. And as somebody who works in a hospital and is intimately familiar with how outcomes are recorded, I don't see how that would happen or could happen with the multiple of, multitudes of people involved in the process. So I would say categorically, no, that doesn't happen.
Great.
Paul, can I add that I would ask people when they have information like that what would be the reason would doctors or healthcare raise the numbers or create the numbers? And one of the answers would be, again, this sort of conspiracy theory that people, COVID is not real and people are manufacturing the numbers. But if you take it to its extreme, doctors and nurses have really no benefit or advantage about doing this. So I would like people to sort of apply their critical thinking skills when they get all this information and ask people close to them about that. So I'm glad that this question is being posed.
Thank you for that. Question from Anonymous. I'm fortunate enough to be in line to get the vaccine as a public-facing health professional. Would the panel mind commenting on any risks that I might still pose to others even after immunization as far as passing on COVID-19? I know that masking and distancing will still be required. Thank you for this informative session. I'll tap Nicole first there and then feel free anybody else to jump in.
Thanks for that, Paul, and great question. So as a healthcare professional, and you're getting your vaccine, that's fantastic. The evidence so far is being gathered around people's ability to transfer the virus asymptomatically to others, even after receiving the vaccine. So the studies are ongoing around that. But so there is an expectation that we continue to still use the public health measures, and it would be very important as a healthcare professional that you wear your mask, wash your distance, and wash your hands, and continue to do that. And as more evidence is gathered around vaccination and about people's ability to transmit it after getting the vaccine, more information will come. And I'm going to ask Dr. Allen if he can add anything to that as well. I see you nodding your head, but I know you've been very immersed in the, with the information of trials, et cetera. And if there's anything else that you could add to my response to help.
I agree 100%, Nicole. I really do. One thing I would add is that is a good news story again, and that is we've seen in the news media and literature where initially there were concerns that the vaccines might not be able to completely prevent transmission, that one could still potentially get infected and transmit. But now the emerging data actually suggests that they're actually able to do that to varying degrees. But there's another thing to remember, and that is it's likely that if somebody gets vaccinated and is still transmitting virus after being vaccinated, chances are the amount of virus that they transmit is lower than if they hadn't been vaccinated. So they should still follow all the public health measures, but it still is a good news story in terms of what happens after you get vaccinated.
Maybe one quick follow-up there for you, Dr. Allen. You've answered some of this already, but a question from Natasha Brown. What are the chances of getting COVID after you've been vaccinated? How long does vaccination last? And do you think this will be a yearly vaccination, like the flu vaccine?
So that's a really great question. We don't know for sure yet how long the protection that is provided by these vaccines will last. And so we just need more time to be able to tell that. And so it's important that the studies are done to evaluate how our immune system responded and whether or not we were able to maintain good responses a year later. And so that's really important. It's possible that we might need periodic boosters. We don't know that for sure yet. I don't know if it's going to be like the flu vaccine, but these are data that are being generated as we move forward in time. So it is really a great question. We just don't have the answers just yet. But for now, again, get vaccinated, because even if you do get COVID after being vaccinated, it's likely to be very mild.
Got you. Thank you very much. Question here for Dr. Azubuike. How is culture impacting people's decision to take the vaccine? So there may be some cultural aspects here that folks are trying to get at.
I agree. Culture does or can impact, can have the effect of leading to some hesitancy, some concern we were talking about earlier with regards to our history of anti-Black racism and systemic racism within the healthcare industry, and our own experiences over the years of being treated in a discriminatory and disrespectful way. But I don't want culture to create too many stereotypes and too much of a broad brush. The sense of there are different communities where there may be more hesitancy and more concern, and also there may be different communities where the information is not being gotten to. And I think some of the other panelists have alluded to the fact that there are a lot of efforts being made to reach communities in getting them more informed, so that misinformation and myths can be busted. But I think the awareness that in our indigenous, in the African diaspora, that there are varying rates of what people believe and what people feel confident in. In my own work, with a lot of people of Caribbean background, there's a lot of hesitancy about what's going on. And what's fascinating to me, and what hasn't been talked a lot about overall, has been how the Caribbean and certain parts of Africa, they're handling, or at least their numbers, and even if you think their numbers are underreported, they're handling it much better than we in the first world North America, in the sense of people adhering to certain concerns and the numbers not being as high. So I think culture does have an effect, but I think how we can address that is by the outreach of information and the outreach of efforts to help people understand that this is disproportionately affecting certain cultures. And we need to address it as aggressively as possible.
Thank you for that. Question for Dr. Todd. So we know that frontline healthcare is represented or overrepresented with a lot of women of color, particularly Black women. And we know that many of those folks have been have acquired the actual COVID-19 disease. And so the question from this person is, how are panel members involved in addressing this, and are they advocating for things like stable employment and adequate income for these employees, or other protections?
Sure. So I think it's been addressed a little bit. Nicole had mentioned some of the efforts that are going into, public health efforts for the Black population in general. And I think just having this panel and this task force in general is monumental in terms of, protecting Black health. So there is, this specific group of people who have been set up to protect the Black community. And I think that is sort of one of the steps. And where we go from here is sort of a bigger conversation that we have. So I think this is sort of the beginning phases of a much larger conversation that we have around protecting Black health and protecting Black healthcare workers in particular. So there have definitely been conversations behind the scenes about how we go about doing that, who is particularly impacted by this, and that's why we're having this conversation today. So definitely there are a lot of conversations and things, the wheels are going in terms of helping to protect this particular population.
Thank you. Question here for you, Nicole. As this program rolls out to the general populations, will Toronto be tracking vaccination numbers? And will there be an approach to engagement or communication plan to target those who don't want to be vaccinated? We know that the racialized communities are most impacted by COVID-19 based upon numbers, so 80% based upon those numbers. However, it seems as if this is the same population that is most hesitant, and we know that herd immunity is part of getting at that transmission. So, you spoke, I think, a little bit to this a bit earlier, but I guess this question is really asking to just go a bit deeper. Is there a bit of a methodology as to how we're reaching out to folks, and I don't want to focusing rather than targeting, focusing on particular folks.
Yeah. So it's a great question, and it is something that we've advocated for with the province, so that when they're rolling out the vaccination program and the systems where we collect data, that social demographic data is also collected, so that we can see which groups are taking vaccine and identify pretty early on in the process if there's any gaps or groups that are missing that we need to continue to do our work. So we've based the information around vaccine hesitancy on evidence that has been gathered even pre-COVID. And it's very important that we continue to do that outreach in the community and work on specific groups. So as part of the Toronto COVID health equity plan, it looks at some of the short term, and I started to talk about that, but short term to deal with COVID and the immediate impacts that it's having in some communities more so than others. So a lot of work is looking at that, and as well to look at longer term health equity issues. And that is getting to what Dr. Candice was talking about earlier around reducing precarious jobs that individuals have, getting more stability, having paid sick days, etc. So there has been a significant level of advocacy that's happened through the Board of Health at Toronto City Council as well for those issues that we know will help support people in the long term. There was a lot of advocacy a few years back on guaranteed income, which is something that we've seen as well. And we continue to do that advocacy work with the population. So it's very important as we roll out vaccines, similar to what we did when we were seeing cases of COVID. Toronto was one of the first in the province to start collecting the social demographic data so that we could see through the evidence the differential impact it was having on certain communities, Black communities, Southeast Asian, Latin, and really to tackle the root causes and issues that were creating that situation. So we continue to do that work. It's big work because it's really tackling systemic racism and the risk factors that have been created over time for certain groups because of the conditions that they live in, not having access to higher income paying jobs due to racism and discrimination. So all these things come into play when we're looking at vaccines specifically and vaccine hesitancy within the community. So as Paul mentioned, an important part of that work was pulling together this Black task force, working with Dr. Kente as a special advisor to the city to really start to tackle and have the community conversations and get that information out there. As Dr. Allen said, we want people to make a decision to take the vaccine or not based on having the true information. So not to make those decisions based on misinformation. So I think all that work is a very important step in looking at vaccine uptake within our community.
No, thank you. Thank you very much for that. I think it's critical that we understand the work and the thought that many folks are actually putting into this. Question for Dr. Allen. So you may or may not have seen some of these maps, but in the coming months, and I think already we've seen a very predictable and familiar map of Toronto showing up, where in the Northwest, particularly in the Northeast, we see that if we overlay things like race, income, COVID-19 rates, sometimes if those maps are available, data is available, chronic disease rates, you see the burden of these diseases kind of map onto these parts of the city. As it relates to COVID-19, how do we stop this map, this kind of predictable trend from becoming the trend around those who haven't taken the vaccine? How do we make sure that vaccine rates in these parts of the community are we're not seeing, where disease burden is highest, we're also seeing the least number of vaccinations?
No, that's a really important point. That is so important. There are a number of things that we need to think about, and one of those is to recognize that it seems entirely reasonable that if there are many cases occurring in a particular region of the city or the country or the province, that it would seem entirely reasonable that those regions should be prioritized for vaccination. It seems to make good sense. And so I know that is part of the strategy to ensure that areas that are hardest hit are being prioritized for vaccination. The second point I should make is that it's important that people residing in those areas that are hard hit by COVID, when they hear of vaccines being prioritized for them, that it's not meant to indicate any stigma, any finger pointing or anything. It's not their fault. And also it's important that people delivering that message of ensuring that those communities are protected should communicate it in such a manner so as there's no finger pointing, that there's no misinterpretation of the intent. So if you are telling people that, we're gonna ensure that your area is vaccinated and that you're being prioritized, people don't think that they're being prioritized because people want to see how it works in that group, that you're really being prioritized because we really think that you need it. You need the supports that are required to protect the communities. And part of that is ensuring that the vaccines reach you and that there are several layers of that, of course, viewing things through an equity lens to ensure that people have access to the vaccine and that they are not just prioritized for vaccines, but they don't get it.
Perhaps a very quick follow-up there. As it relates to transmissions in certain groups, are there studies that suggest transmission more in certain age groups? Are we seeing certain age groups be transmit the disease at higher rates than some?
That's an important question. It's a good question. Those transmission rates across age groups do vary from jurisdiction to jurisdiction. That said, we know that traditionally with respiratory viral infections, that under the right circumstances, children will transmit. When kids get together, they can transmit. We know that. But what's really important is not so much whether or not those groups are likely or less likely to transmit, but what can we put in place to reduce the likelihood of transmission by the various groups. So for example, in the setting of schools, what can we do to reduce transmission in those settings so that kids can attend school safely? What might we do and what should we do to reduce transmission in overcrowded situations, in situations where there are multi-generational homes? And so if you have one person living in a home, there's nobody to transmit to. 2 people, it's not that bad. When you have several people, then potentially more transmission might occur in that setting. So it's not just a matter of age, but a number of people getting together. And so that's why the public health message around physical and social distancing is so important. But also on the issue of transmission, it highlights the importance of recognizing some of the various social determinants of health-related issues that are not anybody's fault at the moment. Why they get COVID, there may be structural historical issues around racism and discrimination that might facilitate that. But at the moment, they are faced with the situation that they're living in, and that increases, those situations increase the risk of transmission, particularly as I alluded to in crowded environments.
Thank you for that, Dr. Allen. And we're starting to have the questions roll in, so we have many more for you, but I want to turn to Dr. Azubuike right now and ask the question. So, Dr. Allen was speaking a bit around children and a bit around schools, and we know that with testing happening in schools, we're seeing that there's higher rates in some communities. How can we prepare our kids for just some of the realities of dealing with this, knowing that, as a result, there may be increased stigma in some sense? How do we really work to prepare our children around some of the things that they're hearing or seeing or feeling?
Okay. Thank you, Paul. Good question. One of the first things I always say when people ask me about how children are affected and how children can respond to traumatic, difficult, horrific situations is that we must always be aware that how we as adults, how we, the authority figures, how we, the parents, how we react to those situations are often the driving role model for how children respond. We set the tone, or we can set the tone on how they respond. So one of the things that we can do is to sit and talk with our children about, at their own level, about what's going on, what can happen, what is to be expected, and don't lie to them, because there's so many resources of information and misinformation out there. That's important that children know that when they're talking to their parents or community leaders or teachers, that they're getting the best information. And by doing so, we can help them understand that this is what's going to happen. Sometimes people may react to you in a particular way. This is the way that you may respond. This is what you can say, and give them the tools, again, at their level. And often when you're talking with kids at all different levels, the younger they are, you answer very simply, and you give it a succinct response about what they need to say. I have COVID, or my grandma had COVID, but I'm negative, or we've gotten better, or all my family is now vaccinated, things like that, so that they have something ready to respond. But always remember that we, the adults, we, the authority figures in the community, we set the tone of how children will respond in these sort of situations.
Thank you for that. I want to turn to Dr. Todd now and ask a question from Caprice Roland. When considering the social determinants of health, how does this vaccine effectively move community towards a better score when considering the other variables that may determine one's health? Was that clear?
I'm just reading it now.
Gotcha.
Okay, so absolutely, there are a number of other factors that are contributing to the health of Black people and Black people affected or afflicted with COVID. And, it's the reason why we are overrepresented in these numbers. When we're looking at social determinants and the vaccine, we really are just trying to protect these people who, because of these social determinants, aren't adequately protected in a general sense. So we're really trying to target this population because we see that we are negatively impacted by a lot of social determinants. So I hope that answers it somewhat, but essentially vaccination is protecting this community, and we are focusing on this community because of our social determinants and our lack of access and our overrepresentation with COVID.
Thank you. Still answering the questions that are rolling in the Q&A, so feel free to drop them there. I'm going to stop calling on folks and have whoever feels they're most equipped to respond to some of these. So the next question is, can garlic or ginger help prevent infection? I'm seeing these messages on WhatsApp.
So probably a question for me. And so no, I would be remiss to let people think that garlic or ginger will be protective against COVID and against the severity of disease, against death if you get COVID. Is it something that you can maybe potentially incorporate into your overall wellness program? Yes, but is it going to protect you from getting the disease? No.
Thank you for that. Next question is, I'm a PSW and I haven't returned to work because I still have concerns. Can coronavirus be transmitted through feces or urine or other bodily fluids?
Yeah, I can take that. It is possible to detect the COVID virus, if we call it that, in feces and urine. Whether or not it's actually viable virus that can infect people is less clear. The important point, though, is that even if there's virus there in urine and stools, there are things that we can do to reduce transmission. And so, for example, hand hygiene measures would be really important. The precautions that are usually taught in hospitals and in long-term care facilities when handling stool and urine should be adhered to. Those include how one deals with flushing the toilet and getting rid of waste material and the precautions around that. So, you know, in terms of material being sprayed around. So those are things that one should ensure that one follows the precautions. The likelihood of transmission through stool and urine would be extremely, extremely low.
Thank you. The next question is, should I continue to breastfeed my baby if I have COVID-19 or expect or suspect that I have COVID-19? Feel free, Nicole or Candice. Public health. And
I think Dr. Allen would be best to answer this one as our infectious disease specialist here. So I'll let him go ahead first. Thanks.
Yeah, that's a great question. It's always a delicate balance when a mom has an infectious illness and what one does with the baby. And so usually we like to encourage moms to continue breastfeeding. But what's really, as a general principle, but what I think we should do is that each case is assessed on its own merit to ensure that moms who are handling their babies wear a mask, they're proper hygiene, covered with a gown. There are various things that they can do to reduce transmission to the baby.
Thank you for that. Question from Facebook from Patricia Johnson. Are you aware of any cases where individuals who have taken the vaccine have had resulting health issues, for example, a heart attack or a new diabetes diagnosis, where these conditions were not present before?
No, we're not aware of any of those. And as Nicole alluded to, there is a very carefully structured surveillance mechanism that has been put in place to detect any side effects whatsoever, whatever they are, after vaccination. But if you're asking about appearance of diabetes, appearance of rheumatologic conditions, worsening of existing conditions that were there prior to vaccination, those have not surfaced as concerns.
Got you. Maybe a slight change of pace here. When it comes to the responsibility that social media influencers have, or versus those who are kind of in the health field, we know that there's been a lot of conversation about those who have traveled and have not traveled. Some folks who are social media influencers, and some prominent folks in communities. What is the responsibility of some of those folks? Well, not folks in the health space, but folks who are social media influencers or community leaders. What's the responsibility of some of those folks as it relates to this conversation around vaccines, staying safe, and COVID-19?
I can start to answer that, Paul. It's a great question, and social media is pretty open. People can share their opinions, and it's very unfortunate because some of this misinformation can go far and wide, and is really detrimental to people seeking the care and supports that they need. So I think our hope and our wish would be that social media influencers share information that is evidence informed and reliable, and are utilizing information that are from, scientific sources, such as the CDC, or going to the Toronto Public Health, I will, say website, or Hospital for Sick Kids, etc., and share that information. And however, we do see that there is a lot of misinformation, and particular groups that don't support public health measures, or are quite vocal and opposed to them. And this is, something that we struggle with as we try to get the evidence-informed information out there to individuals to kind of, I guess, battle that misinformation and the myths that can continue to be perpetrated. So it's very unfortunate. We would hope that people felt more of a social responsibility to get truthful information out there, but that is the nature of social media as well. And I think we're all aware of different, Facebook, Twitter, all the others. I can't keep up with all of them. If there is clear misinformation that has been proven to be detrimental, that sometimes accounts get blocked, etc. So I think I'll leave it at that and open it up for anybody else insight around that one.
I just want to say that I agree with Nicole. I think I would hope that social influencers would make it their business to make sure that when they convey information, that it is evidence-based. I often call myself an empiricist, meaning that I like empirical evidence. Something has to be scientifically sourced, and I hope they can. But by the nature of social influencers is that they are giving their opinion, and they're marching to their own drummer. And I hope then that the consumers of social media, that you all will be much more critical and discerning in your consuming of the material or the information that you're getting, and look to places like panels like this, and to other places in the community that you trust, and listen to them. But it's a sad fact that so much misinformation is being transferred. Not that that has changed. We've always had pockets and corners in our world of people saying things of rumors and Anansi stories and myths, but it's just that the technology can broadcast it so much far and so wide. So we all have to take a responsibility in making sure of questioning, and as I said before, using our critical thinking about what we hear and what we see.
Thank you for that. The next question is around mental health and anxiety, and I think I'll start with a bit of a short story. It's I go to a university in the city, or at least I used to. There was an incident where, long story short, security came, police were called, sort of a carding situation. But the situation was so, I actually couldn't believe it was happening. I'd been on campus for over 10 years, knew folks well, really felt part of the community. And I couldn't believe that kind of an incident would happen. So went home, took the train the next day. And when I got to campus, I started to feel like I don't know, like my whole chest was just tight. Chest was tight. I was like, oh, you know, what's this? You know, in the kind of space of, I couldn't be feeling ways about this. You know, these things don't affect me kind of thing. You know, I'm a strong man kind of vibe. You know, and as I was talking to folks about it, they said, you know, like, probably want to check in with somebody. That sounds like anxiety. So the question from somebody is, I'm living with anxiety disorder. And, you know, media coverage and seeing all the cases, especially triggering. How can I cope the best? I'm adding my story to the situation, because I think hopefully somebody can also talk to, you know, if you haven't had these experiences before, if you're not diagnosed, what are some of the things that you should pay attention to know when you may be experiencing, you know, anxiety or something. So it's a bit of what should people pay attention to, and if it's something that they're experiencing, how do they cope?
Okay. I will go at it first, if you don't mind. Well, what you were describing initially, Paul, was an anxiety attack. And what often happens is that when you first respond to a noxious or horrific or traumatic experience, often you may be in shock and you may not be at the time responding, and it may be a delayed response. And so when you came back to the original place, that you were triggered and you started feeling the anxiety. And anxiety often comes up when we feel that we're not in control, when we feel trapped, when we feel that the fear that we have or the situation that we have is overwhelming. And when you're living alone and you have an anxiety, and this, if anxiety is based on feeling safe and feeling in control, we are living in a time where we're not in control, where our safety and security is out the door, where whether we go out or stay in, we can get this pandemic, whether we talk or we not talk. So our whole concept of what safety is no longer there. So that has an even greater and more deleterious effect on people who already suffer from mental health concerns. So one of the things to look for is, you know, again, are you sleeping less? Are you, has your appetite been affected, eating less or eating more? More often you're eating more. Are you more irritable? Are you more quickly agitated, meaning get angry or get upset? Do you find that you are having more thoughts of negativity, or even thoughts of what's the use of being here? What's the use? We're going to be in a pandemic forever. Are you becoming more homebound, not even wanting to step outside because of all the concerns that you have? And also, do you have a difficulty relating to your significant others? Are you becoming more isolated within the relationships in the home, be it your spouse, your family members, or even if you're sharing a place with roommates? So those are things when those things start increasing in frequency, things are definitely, something is going on. You are suffering from either some anxiety, some depression, but some response to what's going on is happening, okay? And one of the things to do, which I hope, of course, and I'm biased, is that you reach out to a mental health professional as soon as possible. And if failing that, you reach out to people who you feel comfortable with, clergy and others you can talk with, and who you feel that can offer you some help or air to share what's going on with you. But again, anxiety and depression, you feel helpless. And we can't deny, this is one of the most helpless times of, I would say, most of our lives on this panel. I don't think we have experienced this. Many of us haven't been through wars, but this is something that is a once in a lifetime type trauma. And we all are having a difficult time handling it. And it's affecting us all in a multiplicity of ways, not some more extreme than others, but trust me, we are all dealing with it in a way that is causing some level of dysfunctionality, and is taking its toll in some little small part of our life. So recognize that you're not alone too, and that's why reaching out and talking to someone can be so helpful, that can offer you some specific techniques and strategies to help you.
Thank you. Lessons for COVID, lessons for life. The next question, I think, Dr. Todd, you spoke about a little bit already, but perhaps you could go into just a bit more practical detail for folks. What nutrition advice would you give for someone who may have contracted COVID-19?
Sure. So I guess when we think of somebody who has contracted COVID-19, we think about like severity. So, are these people in the hospital, or are they people who have gotten COVID, but they are not experiencing that severity of disease? In hospital, there have been studies around vitamin C. So that's probably the one with the most efficacy in terms of treatment. So in an integrated approach to treatment would involve vitamin C and then a number of other medications that you get in hospital. But sort of extrapolating on that, having more foods with vitamin C in them, and also potentially looking at other nutrients, vitamin D, for example, zinc, and vitamin A are really important for immune support in general. And then just from a sort of global perspective in terms of nutrition, you want to be eating more plant-based foods, get your vegetables in, get those nutrients in. I know that we like, oxtail and rice and peas and all that stuff, but you want to be making sure that you are balancing those meals with a lot more plant-based foods, healthy proteins, and healthy fats as well. So avoiding fried foods, avoiding sugars, avoiding alcohol as well.
So, I mean, that was actually going to be the next question: is what foods to avoid during the COVID-19 pandemic. So perhaps, you say foods rich with zinc and vitamin A, etc. I have no actual idea. I probably should admit that, but what those are. So tell us a bit, and then I'm the kind of guy that needs to know why, right? So as it relates to the foods that we shouldn't be eating or we should be avoiding, why?
Yeah, so when we're looking at the why, it's really has to do with your immune system, and then it also has to do with the conference of metabolic disease. So diseases of lifestyle and other conditions that we see are implicated in more severe outcomes when it comes to COVID and death as well. So you're looking at, what are those foods that are going to contribute to diabetes or hypertension or cardiovascular disease? And we can see that by and large, it's sugar, it's fried foods, it's takeout. Alcohol also has negative impacts on your immune system, on your liver health, on your blood sugar as well. So that's probably the why around there. Those things are going to negatively impact our health and contribute to lifestyle type diseases. And
vitamins A, I think is C and zinc. What are some of those foods?
Yeah, so some of those foods include, if you want to just make it easy, think about, vegetables, fruits and vegetables. Where am I getting, what are the foods that are going to give me nutrients? So vitamin C, for example, really high in strawberries, red bell peppers, and then citrus fruits as well. Vitamin D is more animal-based, so you're looking at things like eggs, but also you might want to consider supplementation because, you get vitamin D from the sun. So the process of the sun hitting our skin, and there's these processes that happen basically, and that supports the production of vitamin D. But we live in Canada. We're also Black people who melanin actually blocks that process from happening effectively in us. So the consideration of vitamin D, the consideration of, vitamin D supplementation might be something that you look into. And then zinc, really high in oysters and pumpkin seeds. So maybe pumpkin seeds is something that you look into more. And then same thing with vitamin A, you're looking at sort of fattier sources. So fatty fish and then nuts and seeds as well.
I appreciate it. I appreciate it. Sometimes for me, I need the concrete answers to the what and to the why. So I appreciate it.
And again, Paul, this is sort of, these are the things that you include in your toolbox, right? To help support your health.
Dope. One more question before we jump to break. Question about seniors. So I just lost the question, folks. So question from Kim Clark. Is anything being done to reach out to seniors who don't have internet in order to get them pre-registered for the COVID-19 vaccine?
So I can start with answering that question from what's happening here in Toronto. So there is a Toronto COVID or the Immunization Task Force that's led at the city level. And they are continuing to look at different ways to reach out to this particular group through working with home care organizations, identifying buildings across the city of Toronto that has a higher number of seniors living in them, and as well as word of mouth, neighborhood ambassadors going out to the particular communities and buildings, and really, doing almost a door knocking campaign to ensure that people do have access to the information so that when their time, when it's ready for them to receive the vaccine, that they are aware of it and eligible to do that. The city is looking at mobile options as well. So the potential to go out to particular communities or buildings to make it as accessible as possible when we're moving forward with this. And we do really ask that community and neighbors, if you know of an elderly lady that's living in the apartment 3 doors down and you're hearing information and they may be a little bit isolated, we always strongly encourage people to check in on one another, give them the information, assist with anything that they may need to ensure that they have access. So it is really a big, big community effort, as we know people will get information in many different ways and not accessible to all. The Toronto Public Library is also a system that's been very involved in getting information about COVID out to their users. And we know that seniors and other individuals that may be more vulnerable do use the library system. We have, I believe, Toronto Public Library is the most well-used library system in North America. And so they have been really invested in working in getting this information so that their staff can have it and share it with their I don't know what they're called, but the members that come into the library as well. So there's many different areas of information, and we'll continue to do these efforts and somebody mentioned earlier, the data and the collection of data and seeing if there's any gaps, information and comparing that to, information we know about the census and where individuals are living, so we can do some targeted outreach and promotion of the vaccine for everyone.
Thank you very much for that, Nicole. And on that note, we'll jump to break, come back at 4:08. I'll give folks 6 minutes. See you guys in 6 minutes, 4:07. And we're going to get started again, everybody. Welcome back again to the final segment of the Black Health Professionals Risk and Resilience COVID-19 panel. So again, we're going to still take questions from that are coming through the question and answer. So please feel free, folks, attendees, to submit your questions. We have about 45 minutes to continue to go through. I want to pose a question though before we get to all of these questions. I think it's coming up a bit in some of the questions here, but as it relates to, Dr. A talked about trying to stay in the present, so I don't want to take people away from that. A lot of folks have questions around, we're talking a lot about like recovery. We're talking a lot about returning back to normal, and what some of that might look like, what some of that might look like in the future. Nicole spoke a little bit about, even after we take the vaccines, we should still maintain the public health protocols, things like masks and physical distancing, etc. But really, to the broader panel, are there any thoughts around what recovery looks like specifically for our communities, and what this, quote unquote, return to normal might look like?
I think, Paul, that I sometimes question what that definition of normal is, and whether we can return to normal or we'll return to a new normal. And that new normal probably will be a greater appreciation of how our connections and our sense of community and family, how important that is, and how deep and how almost indispensable that is to us. I think that's one thing we will probably be more appreciative of each other. I think we may always be, and again, I will defer to Dr. Zalin, Todd, and Nicole Welsh about the public. We may always be wearing masks, most of us or some of us. We may be doing more public health things. But I think the concern about what comes around the corner, we may be more wary going forward. Like with anything that happens, when we lose control, when we have an accident or a trauma, we are sometimes wary of it happening again. So I think we may be a little bit more concerned about what's happening in a few years down the road. But my hope is that the things that we have missed and the things that we come to appreciate, we will go after, like family connections, people we haven't talked to in a long while. We have reached out to a lot of people being at home during the pandemic. A lot of us have reached out to old school mates, people we haven't talked to, because we had the time and we realized how important it was. I hope we continue that. But I don't want to go on.
And maybe a bit of a reframing of the question too is how does the vaccine help us stabilize where we're at? It's hard to predict the future and predict what that new normal or normal might be, but how does that vaccine help to kind of stabilize us into whatever the future holds?
Well, I think it's important to recognize, and I do agree with Dr. Azubuike, that there will likely be a new normal. But that said, for us to start to stand a chance of getting together with loved ones the way we used to get together before, maybe not exactly the same way, but for us to start to get back to what we might have called normality before, we really need to bring COVID under control. And that requires two strategies. Number one are the public health measures that Nicole eloquently described. And number two is vaccination. And there's a combination of those that will have us being able to do some of the things that we used to do before. But we need to recognize that things won't be exactly as we were doing them before. And we should also identify lessons that are learned, and not just by us, but by the system and the powers that be, such as opportunities to work from home, and how might individuals be supported to work from home. Second is opportunities for international meetings and national meetings and conferences to be done virtually. That maybe I don't need to take a trip to New Zealand next. Maybe I can do that virtually. So there are those types of things that we also we really do need to bear in mind. But there's something else I want to mention, and I know Nicole and I can identify with this. Each year, we go through what we call the respiratory virus seasons, and we see influenza, the flu virus, and other viruses, including one called RSV. The measures that we've put in place to deal with COVID have virtually eliminated those guys. I don't recall seeing a single case of flu since 2019. I know there have been one or two, and literally one or two. So, and similarly, RSV. So what we're learning is that there are things that we can do to prevent some of these other entities that we see each year. So it's for us to step back and learn, say, what are some of the lessons that we have learned that we can apply to how we deal with prevention of infections within our communities, within schools, within long-term care facilities. Those are lessons that we should try to see what we've learned from this bad experience with COVID.
And can I just add quickly too? One of the we've talked about some of the public health measures, which we all know well: wash your distance, wash your hands, wear your mask. Another key message that has, as Dr. Allen said, reduced the risk of those other respiratory illnesses is encouraging people to stay at home when ill. And again, we talked a bit about the need for advocacy to ensure sick pay for individuals so they have that opportunity to do that. This has been a real different focus. I mean, my kids are older now, but I do remember when they were young and childcare, you know, we often send our kids to childcare with sniffles or a cold, or sometimes, you know, even a fever, because there was a need to be at work, etc. And it wasn't really, we kind of worked around it because we accepted a certain level of influenza and RSV in our community. And I think another key piece, and I don't think we've mentioned it yet in today's session, is to really encourage people to stay at home when they're not feeling well. And of course, to have the supports in place so that people are not financially penalized for not coming to work when they're ill, or penalized in any other manner in the workplace. That's a very important aspect of it as well.
Goes to a question that I have that I want to make sure is covered in your answer. So if an employee chooses not to be vaccinated and, let's say, gets COVID-19, does an employer have the right to deny them sick pay? Might be a bit of an employment law question, but perhaps maybe a question that some folks on the panel can answer to the best of their knowledge.
I'll start. But to say I can't really answer that question as an employment law one, but it would, you know, be something that we're advocating strongly for, that people are not penalized in the workplace for things like that. But as far as if it can be done and if there's repercussions from an employment law perspective, I would have to ask for a legal expert to give me some advice on that, unless anybody else has any experience or information around that. I myself don't, so sorry about that.
Got you. And
I agree, Nicole. What I would say though is that if an employer is penalizing an employee because of COVID, that's a very unpopular employer, and we should bring whatever pressures we need to bring to bear on such individuals or organizations.
I would love it. The next question is, I have serious concerns about returning to work. There are extra precautions that my employer isn't taking to protect us at work. What supports does the city or province have it in place to help those who do not want to return to work, or will there be such systems put in place?
I can start. It's an interesting question. There are things at the federal level and provincial level and city level to support people who are off work, who are sick. If someone's choosing not to go into work due to the employer themselves not protecting their employees, then there's avenues they can reach out to Ministry of Labor. They can file a complaint there. It is an occupational health and safety issue. And the employer has the responsibility of ensuring that their employees are kept safe within the workplace. So my recommendation would be to reach out to the Ministry of Labor and file complaints. They will come out and do inspections and can lay charges against any employer that is not providing the appropriate level of protection in the workplace.
All right, and I think just as a caveat, if folks are seeking legal advice to understand their legal options, consult with a lawyer. Folks are providing their best knowledge based upon their experience and expertise. Next question here is, can a vaccine differentiate the difference between the blood of Black people and the blood of white people once it enters the body? Same question about biracial individuals.
Yeah, I can say that. It's a really great question. The answer is based on our knowledge, our best information answer is no. It does generate other questions around whether or not the virus can differentiate. And the answer is that we don't think so at all. But related to that is whether or not there are any genetic markers that might make someone respond differently to the COVID virus, the SARS-CoV-2 virus, based on their race. And there are some research studies that are being done to try to flesh that out. It's likely, though, that if one identifies genetic markers, those markers would likely not explain the disproportionate representation of COVID within racialized communities. But it might, depending on the particular marker, might determine whether or not let's say, for example, a Black diabetic who has a certain marker versus another Black diabetic who doesn't have that marker, whether or not one of those individuals is likely to have milder or more severe disease. In other words, the intersectionality of different variables might come together. And that's probably the way that genetic markers might operate, not in terms of functioning in isolation.
Got you. And I don't want to, get above my station. I'm not a scientist. But I know there's often real concern with folks making genetic links to disease burden. So if can anybody on the panel speak a little bit to perhaps that race and genetics and genetic variation, we have to understand necessarily that there's probably greater genetic variation in between those that we identify as Black communities than there are outside or inside. Do you get where I'm going with that question?
Yeah, I can comment on that. The whole genetics bit is rather complicated. People often, when the average person in the public thinks of genetics, they just think of black versus white rather than what are the genes that make up an individual. Like, you know, you take somebody from Jamaica and just about everywhere in the Caribbean, and you know, a significant proportion of their genes are actually Caucasian genes. So it's not the way that we look is different than what we are inside when you do your ancestry DNA. And so what we do know, though, that the way that genetic markers operate are generally in two ways. One, if there are certain markers that are so profound that you're born with those and they lead to a severe disease, and they're called inborn errors of immunity. And those are typically very obvious, you know, that you know, we can tell. And it doesn't matter if you're white, black, or whatever, you know, those are there. And then there are other markers that sometimes or might be associated with a particular race. And so, for example, there's some talk about the ACE2 receptors and so forth, you know, being different in, you know, African Americans. But the bottom line is that even if those genes, Paul, or differences in genes operate, they don't operate in isolation. It's a combination of factors that would bring out differences. So I don't think that we should believe that the Black individuals are overall any more susceptible or less susceptible. And that when we have the disproportionate representation within racialized communities, that is most likely related to the social determinants of health.
Thank you very much. The next question, while I just organize some of these other questions, is a question for all of the panelists. Have all the panelists had the vaccine or taken the vaccine? And if not, will they be taking it when it is offered? We can go through with Dr. A first.
Well, I always jokingly say, Paul, I'm too young to take the vaccine. I'm waiting for my age group to be ready. But all kidding aside, not as yet. I lived most of my life in the US, and I must admit the one thing, I've been here just about 10 years or so. I am still sort of concerned about the rollout, how Canada is handling the rollout of the vaccines. I hope that we can pick it up so that more people are vaccinated more quickly. But when it comes, I will be open to it, even though I have a lot of allergies, so that has to be something I have to be mindful of. But I am still willing to do it because I think it's not just for me, but it's for my community also and my family also.
Thank you for that. Next question is, again, not for Dr. Allen, bit of a clarification. You mentioned earlier about vaccine efficacy and effectiveness. Can you please expand on the difference? Many thanks.
Okay, great, thank you. Let me just back up by saying that I did, as somebody who sees patients with COVID, I was on the front line to get a vaccine, so I have gotten my vaccines, and you know, so I'm happy about that. Your question was about efficacy.
I realized I jumped questions.
What was that?
So let's the first question was around whether or not folks have taken the vaccines, and then I would pose a question to you around for somebody wanted clarification as to the difference between the effectiveness of the vaccines and,
right,
and the efficacy of the vaccines as you were talking about it. So
sure.
Perhaps we can finish that and then jump back to the.
Sure. So efficacy relates to how the vaccine performed in the clinical trials, where there was one group that got active vaccine, another group that got a placebo or dummy. And so that the specially structured control environment of the clinical trial, and that's where they talk about the efficacy of 94, 95%, and so forth. Effectiveness deals with how the vaccine is functioning in real life, in real world, when it's given in the community. And that might be influenced by several factors. How it was stored and handled and delivered, the cold chain. There are just several factors that might influence practically how it performed in real world situations. So that's the main difference.
Cool, thank you. Back to the other question around whether or not folks have been vaccinated and if they will take the vaccine.
I guess I'll go. I have not been vaccinated as of yet. Like Dr. A, I'm awaiting my turn. I personally have been able to pivot my practice to a largely virtual practice. So I am not in that way seeing patients face to face. But I do have a father who has he has COPD. So, you know, in terms of protecting myself, protecting my family, and just being able to see them without worry. That's what I'll be doing in the future when it's my turn.
Nicole.
And likewise, I'm not eligible yet. I'm not on the priority list. I do not see patients or clients face to face. I am able to mainly work from home, so that offers me with a certain level of protection. And like the rest of the panelists, I too will be taking the vaccine when my turn, when I'm eligible to do so, for the reasons cited, and protecting the community and getting us closer to our new normal as soon as we can. So I'm eagerly awaiting for it to be rolled out and get in line for my vaccine as well.
I guess I should also say that I do intend to take the vaccine when it is my turn, but not in line yet. Choosing the next question here is a question from another anonymous attendee. I'm curious about what happens to a virus like this after herd immunity is established. Could the virus be eradicated completely? If not, would it continue to exist in certain regions of the world and remain health and life threatening, or perhaps weaken in strength? I know that there is much talk about variants and suspect that the virus will remain with us in some form for a long time to come. Thank you, and would like to know your thoughts. Don't want to complicate the question, but another thing that has come up is this idea that if, you know, for example, public health is looking at vaccine hesitancy in various different communities. So population-based communities, so maybe Black communities or white communities, South Asian or Asian communities. And, you know, some folks have talked about, you know, what happens if everybody else takes the vaccine and Black folks don't take the vaccine? Will that cause the virus to continue to circulate in Black communities if a substantial number of Black folks don't take the vaccine? So really, I think with these two pieces of the question, with this virus, once herd immunity established, how might the virus be a part of our lives in the future or going forward?
So Paul, that's a great question. To be honest, and we're still trying to think that through. Let me say that there are 7 human coronaviruses, so 7 cousins. One of those 7 is the SARS-CoV-2 that causes COVID. Another of those cousins is the SARS-CoV-1 that caused SARS in 2003 to 2004. So that's, you know, disappeared. But it probably did so because there wasn't a lot of it floating around to go from person to person. Whereas the seasonal coronaviruses, the ones that may cause the common cold each year, those pop up every year. And there are lots of those around. So there's a possibility that because there's so much COVID around, SARS-CoV-2 around, that it might well be that we will be with that particular virus, the SARS-CoV-2 virus, for quite some time. And it may pop up and down seasonally for a while before maybe it burns itself out. We don't know that for sure, but it's something that we have to watch very, very carefully. The thing about herd immunity is that herd immunity is like, the way to think about it, it's like, a forest fire where the firemen go ahead of the fire and clear certain brushes and trees, remove those out of the way to interrupt the passage of the fire. And that's essentially what herd immunity does. And so if we have enough individuals who are protected, then the forest fire of COVID is interrupted and doesn't march through the communities. So for Black and racialized communities, we need to make sure we have enough individuals protected within the communities, or else you could have, intermittent forest fires that march their way through our communities. And so it's a real important message for us to bear in mind to protect ourselves from future waves of the SARS-CoV-2 COVID illness.
Thank you. Did anybody else have any offerings on that? Seeing that there are none, next question. Can you or should you take multiple vaccines, say the Johnson & Johnson first and Pfizer 1 month later?
No, at the moment, so it's another great question. At the moment, the recommendation is to stick with one. People have asked the question of, well, suppose you did start with the Pfizer and you didn't have Pfizer in the future, can you get another one? We don't know that yet, but for now, the recommendation is to stick with just the one product.
Thank you. Another bit of a technical question. Does the vaccine enable the body to produce proteins to fend off COVID? If so, are there situations where the body overproduces protein, causing thickening of the blood, rare blood cancers, and others in the future?
Yeah, that's a great question. The protein that is produced, if you call it that, protein, it's really antibodies. And so basically what the vaccines, so for example, the Moderna, Pfizer vaccines, they deliver a message to the body, to the cells, to produce the spike protein. And then our immune system recognizes that spike protein as belonging to the COVID virus and responds by producing antibodies directed at that particular spike protein, so that when next time we get exposed to the virus and the spike protein shows up, the immune system is ready to attack it, both in terms of antibodies and in terms of T cells, where some of our body's policemen, if you will, reside. It's a good question as to whether or not a vaccine could result in an overshoot in our immune system, where rather than getting a very nice measured response, it overshoots. So far, there's no evidence that it has happened or is happening, but it certainly is a good question, and it's one of the reasons why, as Nicole alluded to, we have surveillance systems put in place after people get vaccinated, just to make sure that the immune response that we're getting doesn't represent an overshoot, but just the well-balanced response.
Gotcha. I'm going to take a couple more questions, maybe two, before we move into the next segment. Next question is, if I take a rapid COVID-19 test when I get vaccinated, will the results be positive, or will they be positive if I take an antigen test? So if I take a rapid COVID test after I get vaccinated, would the results be positive?
That's a really great question. So when you when one does a test for the presence of COVID, you can look at little pieces of the virus, or you could look at antibodies to the virus. Depending on the particular antibody test, it is possible that you could detect antibodies that came from the vaccine versus antibodies that came from a viral infection. But in general, the tests that have been developed and calibrated for diagnostic purposes are developed in such a way that their focus is to detect infection and not to detect vaccine responses. But you could have, and it's important to know what type of test is being done in the future, you could have tests that are done in a rapid manner that might detect antibodies. And it might, at that point, depending on antibodies that are detected, it would be difficult to determine if those antibodies came from a vaccine versus from natural infection. The lab scientists have some sophisticated ways of telling the difference, but for a screening test, it will be important to be able to know what it's detecting, to be sure that you're detecting antibody related to the vaccines versus antibody related to infection.
Thank you. Thank you. I have a bit of a question here that I'm going to try and paraphrase because I think it's important. The person is asking, and you can probably see it in the chat as well. How important would you say that having the public know that we have old and inexpensive antivirals and anti-inflammatories that are used in abundance? The person, I believe, is trying to suggest that we have all that is needed to treat anybody with serious symptoms for COVID-19, and wouldn't using these antivirals or anti-inflammatories be, if used early to treat these symptoms, wouldn't it work in terms of just 99% of the recovery and the treatments that folks are getting? So how effective is a vaccine? If you have things like remdesivir, for example, do you need the vaccine?
Yeah, I can comment, and then others can chip in as well. The bottom line is, at this point in time, there is no effective antiviral agent that cures COVID. We have antiviral agents that have varying effects on COVID when tested in the lab. When put in clinical trials, the effectiveness vary from being none to some in certain selected circumstances when used earlier on. But we don't have a magic bullet, so that's an important point. The agents like dexamethasone are helpful. They fall in a category of medications that are supportive or help to dampen our immune response to the infection, so that the body doesn't overshoot in terms of an immune response to the virus. So that like dexamethasone has been shown to be very helpful in that regard. So, but vaccines operate at a different level. Vaccines are preventing you from having the problem in the first place. And it's been well shown in public health that prevention is better than cure. And so vaccine efforts over the past many years have shown that it's much more efficient, more cost-effective, more beneficial to actually prevent the illness than trying to cure it with medications. Nicole, would you agree with that? I mean,
Yes, most definitely. So it's really looking at a more of an upstream approach. And I think, and Dr. Allen, you can correct me, but for some of these treatments, the dexamethasone and remdesivir, I'm not going to say it right, but I don't know if those always have to be IV administered, or somebody would have to be quite ill and in hospital to receive some of those treatments. And we want to avoid that from happening altogether as well. That puts an stress on our healthcare system, and people for other reasons may not be able to get access if they're suffering a heart attack or a stroke, because our system is full of individuals with COVID that require significant treatment and medication. So the more we can prevent is much better, and allows for the opportunity, as you said, over time, maybe it will get eradicated, like we've seen with other illnesses, and that vaccines have been instrumental in getting rid of in the population. Treating it will never actually get rid of it. It means people will still become ill, and will have to receive treatment. So very important to do the upstream preventative approach.
yeah, I agree.
Thank you for that. Sorry, I was on mute. I'm going to turn into our last segment here with a bit of final thoughts from panelists and a bit of answering a question. So feel free for folks to jump in with the last message that you think folks should have from you today. And then the question from the chat that I want to pair with this is how you think this discussion should continue to flow. What do you think folks need to be thinking about or engaging in as this rolls out into the summer and beyond? So your thoughts, and then a bit of how will you or how should we be continuing to engage in this conversation? We'll start with Dr. Todd.
Sure. So some final thoughts from me. I'm a naturopath, and I look at things from a holistic perspective. So again, looking at all of the things that are in your toolbox and really assessing your risks and the risks of the people around you when you're coming to the decision of whether or not you want to take the vaccine. I think it's really important that people make informed decisions, as everybody was saying, and just understand that vaccination is something that we can include. It doesn't have to be a this or that type of thing when we're looking at sort of a lot of people want to look at sort of natural ways to support their immune system or be preventative. It doesn't have to be a this or that thing. We can do things in a holistic manner, and vaccination is one of those things that is evidence-based and can confer protection on this community in particular. And in terms of where we go from here, I think that this is definitely the last town hall, but definitely the conversation needs to continue. And I encourage people in either the chat or in the questions to submit some of the questions that they have around vaccination, around health, and where you want to see this task force take you.
Thank you very much, Dr. Todd. Dr. Azubuike?
Yes, I have two quick things. First, I wanted to ask a question that I have not seen anywhere, and since I treat people with needle phobia, people who are afraid of needles, and I was wondering if there are any other ways to convey the vaccine. I remember as a kid taking the polio or one of those vaccines by mouth, but just in case, and there's some people in our community who maybe have a lot of needle phobia and may be reluctant to do that. So that's a question I haven't seen anywhere since vaccination became a big issue. That's one out there. The other piece I wanted to add was that I think something like this, panels like these need to be on a continuation basis, because there's so much misinformation in our community and there's such concern and hesitancy that I think we need to have opportunities and resources to combat that. And I think in addition to that, I want to end just what I have to say about asking about the anxiety and what to do during this time. It's tough to stay in the now, in the moment, and not get too pulled in the future or too pulled in the past. But I like to end with a kind of quote attributed to Nelson Mandela, who talks about, and I hope I get this right, he said that basically my body was in Robben Island for 27 years, but my mind never was. And so for us to recognize that even sometimes in the most restrictive and horrific situations, our mind is very powerful in how we deal with these things. And we can deal with them. We are much stronger than we think we are, okay?
Thank you, Nicole.
Yeah, so thank you very much for that, Dr. A. It leaves me thinking quite a bit, and I do appreciate that. I think, like the others have said already, is to continue the conversation, to talk to our friends and families, let people know where reliable information is so that the conversation can continue to happen. And to just remember to take care of ourselves, one another, our neighbors. It's so important for us to survive and be well on the other end of this. And it is something that I do worry about when we see the impacts. It's been such a significant change in a short period of time. When we think back to even a year ago, things were quite different in our world. So just continuing to support our one another. And I do see the vaccine and the availability as hope for things looking a little bit different. It may be a new normal, but a hope that we don't have to continue under these levels of restrictions. And I think that's it for me.
Dr. Allen.
Thank you very much. A few thoughts. And I like the question that Dr. Azubuike mentioned. I think that it's definitely an area for future research to come up with needle-free systems. And I know that it's something that has been worked on for other vaccines. Whether or not we'll be able to deliver the COVID vaccines through oral or intranasal route might be up for discussion, but you're absolutely right. I think needle phobia is an important issue, and so it's something that's been highlighted as an area of research for sure. In terms of a couple of closing comments, I think it's really important that we remember that beyond, and I'll make two comments, beyond the immediate future of addressing issues around COVID and vaccines, that there are things that need to continue to be brought to the forefront of discussion, so that the powers that be are aware that social determinants have to be addressed, and that we had signals in 2009 that social determinants were influencing the H1N1 pandemic. So we need to bear that in mind so we don't run into the same situation if we have another COVID in 2025 or years after that. So addressing the social determinants beyond COVID-19, I think it's important. The other closing comment I'd make is to remember that we're all in this together, and I often say, and this often relates to some of the things I say to children when they're infected and they're feeling guilty that they got infected, that the COVID virus is a great equalizer. And whether or not you're the future King of England like Charles, or you are a president of a country, or you are the fastest man ever born like Usain Bolt, or you're as strong and healthy as The Rock, or you're a member of the Toronto Raptors team, you may get COVID. And you shouldn't feel guilty about that. It's not your fault. And so I think it's really important that we remember that it's a great equalizer, but we just need to continue our efforts to reduce the community transmission of COVID, and vaccination is one of those strategies.
Thank you for that. And I know sitting through 3 hours of answering questions, even with 5-minute breaks in between, is quite the task. So I would really like to thank you, Dr. Allen, you, Dr. Todd, you, Ms. Welsh, and Dr. Azubuike for coming to answer the community's questions and provide your expertise and suggestions here. I think just a few thoughts to summarize the conversation. We heard that it's important to get the right information. Some of those sources for information are your public health websites, is the Ontario government, the TorontoBlackCovid.com site, etc. And we're working hard to streamline and pull together areas for information for folks so that they can get the right information around taking the vaccine and how they make their decision to take that vaccine. We heard that it's important to stay in the present, really think about what you're feeling and how you're going to not dwell so much on the past or into the future, but think about where you're at right now and be in tune with yourself and grounded. Really think through where you're at. And if you are feeling different from your baseline or different from where you normally feel grounded, it's important to reach out to those that you trust and reach out to professionals that may be able to help you and support you there. And there are some resources that have been put in the chat. We heard a bit about the necessity to think about your toolkit, your health toolkit. So eat good food. Am I getting it right, Candice? Fruits and vegetables. Thinking clearly about vitamin D and whether or not we want to take supplements and engaging really with your health in a robust way. The vaccine is one part of that toolkit, but it's important for us to really think through how we're planning our lives and our food and our health, and again, get those nutrient-rich foods. Lastly, COVID is real. A lot of folks are working very hard. I think, as Nicole said, a lot of folks are working hard in the background to make sure that the rollout of the vaccine is equitable, that folks who are at most risk, whether those be folks in long-term care or folks in particular part of the community, are getting that. And a ton of work engaging folks with regard to how that information will come to them, where they'll be able to get those vaccines. And so if you're in Toronto, pay attention to your Toronto Public Health website. If you're in other parts of the city or the region, let's say, or parts of the country, pay attention to your local region and province. And then lastly, social determinants of health. A lot of folks are engaged in this work right now because they care deeply about communities. They care deeply about making sure that communities are safe. Vaccine is one part of that conversation, but we're not just focused on that. We're actively focused on the social determinants of health, making sure that folks have the sick days and the housing conditions, that we're addressing issues around food insecurity and et cetera. So as folks have thoughts or questions on those pieces, feel free to email us. Some of those emails and pieces were in the chat. The email at Black Health Alliance is info@blackhealthalliance.ca. My name is Paul. Thank you for your time.
I need you to repeat that email address. Sorry, Paul.
Sorry, I'm going a bit fast there. The email for Black Health Alliance is info@blackhealthalliance.ca. feel free to email us there, and we will do our best to respond. We are small and but mighty. My name is Paul, and I'm going to throw it over to Aqua to thank you everybody for your time.
Excellent, excellent. Thank you, Paul. I want to say I want to big up Paul Bailey and big up all of the organizations that have supported the task force and the town halls. So it's the Black Health Alliance. Last week we had Lieben Gabriel Michael at Taibu. The week before, Lorianne Green Walker from Women's Health and Women's Hands. Before, the previous week, Henry Gomez, Harriet Tubman Institute at York University. And previous to that, Oniya Naram, the Black Physicians of Ontario. These organizations have supported us throughout, and we'll continue to collaborate with them as we get through this COVID period. I want to say a special thank you to the members of the task force for whom this is more of a duty than anything else. They do this because of the shared interest with members of this community and actually many communities. And that's the primary driver for these 3-hour meetings. And we tried 2 hours, but we found that in 2 hours, we couldn't answer half of the questions that we got. So we stuck with the 3 hours, even though it's quite long. And I'm so grateful to so many people for sticking through the 3 hours, because my Zoom tolerance is so low that, I really am in awe that throughout the 4 town halls, 5 town halls, people have stuck with us from beginning to end. This would test you the determination to learn and to know. I also want to thank the city for its leadership and for supporting this effort, given the risk that communities face. And finally, before I have my own 4 comments in terms of all of the town halls and this one in particular, I want to thank the people behind the scenes. Ika, Nicole, Leslie and Lisa, from Tiffany, Ashley, Sanjeev. These are all people who are working assiduously on the website, on the social media, on developing our Q&As to sort of amplify the positive messages that we're trying to give back. We have heard from so many people such complex as well as straightforward and simple questions over the past few weeks. History questions, geopolitical questions, science questions, sociology questions, questions related to the social determinants of health. And all of these questions, we've tried to answer it on the basis of science and evidence, but grounded in culture. So, we take the science and we don't just throw the science at you, we ground the science in your own cultural understanding and our own cultural understanding of how we infer some of this information that we've been getting and some of the misinformation that we've been getting as well. We agree, I think every task force member would agree that trust has to be earned. It's not just a question of Black communities not trusting institutions, it's also a question that institutions haven't done a lot to earn the trust. They haven't done the outreach. They haven't addressed the questions in a way that demonstrated sensitivity to where those questions were coming from. One of the things I've noted in the past few decades that I've been around, maybe 2, I don't want to say too many decades, is this ahistorical approach, as though when we're in a crisis, all of a sudden we're in a crisis and it's never happened before. But when these crises happen, there's a lot of people who saw it coming, and with the social determinants of health, a lot of people saw the risk and talked about the risk, but they weren't taken quite seriously enough. So we know that systemic anti-Black racism is a contemporary lived reality that influences the way people make decisions about vaccines. We also agree with many of the people who have come and sent us their questions and called in and Facebooked in and YouTubed in, that the statement Black Lives Matter is not just a movement, it's a values commitment, a values principle. The reason why Black Lives Matter is a movement is because, for obvious reasons, Black lives aren't accorded the value, the equal value that they're entitled to. And some people respond to Black lives by saying all lives matter, as though Black Lives Matter suggests that. It doesn't. It's about the reality that we live with and the desire that we have that Black lives should have the same value as all other lives. No more, no less. And that's very important. We also recognize the social determinants of health issues and the need for continued advocacy and public education around sick days, housing conditions, income, poverty. These are takeaways that we will leave with. But finally, I think it's very important to say that we recognize your individual human rights to choose whether or not you get vaccinated. But the only thing we say is that let the decision be informed by evidence, not opinion. It's okay to have an opinion, but when you make a big decision that has life-saving ramifications or life-losing ramifications, please make sure it's the best weight of, you have all of the evidence you need to make the right decision. And that's all I think that needs to be said. We will continue to try and understand we were thinking that this might be a short term, end of April, end of March we'll be done. But we've gotten so many requests from employee groups where Black employees have a lot of questions about the vaccine, and we are endeavoring to address that and maybe meet with them. We also want to see the vaccine rollout and support the vaccine rollout to make sure that that rollout comes to you to the maximum extent possible, so that you don't have to go to it. Because many people in our communities do not have the resources, the ability to just take a day off to go and get vaccinated. And we have to actually recognize their reality and work with them to ensure that getting a vaccine is not a problem or an issue. And with that, I thank you for your invaluable time. And I hope that you have gotten what you came for with us today, thank you so much.
Thank you.